So there are a couple of different ways of looking at your weight. One is the more traditional way, which is the body mass index or BMI, and that's derived from a simple table that takes into consideration your height and your weight and assigns a number, a BMI or body mass index. And we have different categories of BMI for what we would consider healthy or overweight or obese. The problem with the BMI, of course, is that it doesn't make a distinction between how those various components of weight contribute. And for example, I've had patients come into my office who are extremely muscular, but by their BMI, you would say they were overweight. And yet to look at them, to examine them clinically, you see there's very little lean on them. And this is clearly a case where BMI fails. I've seen other patients come into the clinic that have what we would call a healthy BMI, but it's clear on examination that they have wasting of muscle, what we would call sarcopenia, and an excess of body fat. And so to say that they're at a healthy weight would be a misunderstanding. So we have to move beyond BMI to other measurements. Now, there are scales that you can buy that do measure body fat. I own a pair myself. They have what look like little shiny silver electrodes on them. They conduct a very low currency current through your foot that you can't even feel to give you, based on an internal algorithm or calculation, what they estimate to be your percent body fat. And some of these scales can be reasonably accurate. However, they're certainly by no means as accurate as the DEXA scan, which is the most scientific way of calculating how the different components that make up your personal weight are having an influence. And again, the body fat you get out of a scale isn't going to tell you how that fat's distributed, which is equally or perhaps even more important.